Sawasdee Krap, and good afternoon once again. Today is Wednesday, the 10th of November 2021, and this is the English language summary of the press briefing here at the Center for COVID Situation Administration, or CCSA, as always. So first of all, I'd just like to mention about the festivities, the upcoming festivities. One important festivity is, of course, Loi Krathong Festival. For the CCSA, we've discussed this, and if it is in the scale of small-scale private Loi Krathong activities, that of course is permitted. But large event-sized Loi Krathong festivals, that would have to be in discussion with the CCSA and health authorities. This is of course to prevent large congestion and gatherings of people during festivities, as we have mentioned in earlier briefings already. Aside from religious activities, festivals, Loi Krathong, and other types of congregation. So I'd just like to mention first, before starting with the vaccination progress, about a couple of important issues. The first is about a couple of words first, perhaps. Situation, context, and approach. Of course, there is a common situation that the world is facing right now. It's a template that everyone's facing in terms of COVID, in terms of situation. Now, in terms of the context, of course, the context is the same. The situation may be on one table, one scale, with numbers of those infected in each country. So it's like we're all on the same table, all on the same chart in terms of the situation. In the context, of course, the context of the COVID pandemic affecting everybody. Now, approach, there are also common approaches that many countries are taking. But my point is that there's not always a template situation, a template context, or a template approach, meaning that every context for every country is different. So just as an example, the context of some countries may be that they began with, before COVID, they had many tourists, up to 40 million tourists. And the situation, the numbers in each country would be different as well. And the approach, for example, the approach of Thailand is one approach, of course, that we have used all along, is about the quarantine approach. So that has been sort of like the landmark or hallmark of our COVID prevention. So as you can see, the context and situation is different in every country, as well as the approach. And no country would have opened up their own borders in the same way that Thailand has, because the context, the situation, and the approaches are different. So in our case, we had 63 countries in the list of quarantine exemption, right? So no quarantine. Prior to this, we adhered a lot to the quarantine system. We had 7 days, 14 days, according to each category. And of course, the context that we had is, of course, we had a lot of travelers pre-COVID, and now it's during COVID and post-COVID, of course, less. So therefore, no country has done the way Thailand did, because of the different context of Thailand with other countries. In the same way, the context of other countries is different as well. They may have opened up their country, but the situation and the context and the approach is different. So what I'm saying is that you cannot compare apples and oranges, even though the context of the COVID pandemic is the same. The approach that we have taken is for the most effective control of COVID in Thailand, a country that has had many travelers and visitors, 40 up to 39, 40 million per year. Many people hoping to visit Thailand as a destination. And of course, with our schemes, the quarantine exemption for the 63 countries and territories is aimed at this. It's aimed at bringing back this balance. And our approach to quarantine has been something that's very important. And the exemption is, of course, according to the rules and regulations set. So just to put that up first in terms of comparing contexts and approaches. Whatever we do, of course, is for the good of the Thai people, as well as our foreign friends and visitors coming to Thailand. And this Friday, we'll be having the general CCSA meeting, because it's almost been 2 weeks, 14 days after November 1st, which is the official opening up of the country. So we will be reviewing the various approaches, context, and situation, as I mentioned, in order to improve for the betterment of the country and the situation. So hoping for your understanding on this, that there is no template and the context of each country is different. We value the context and your, of course, of the situation, and we value your understanding on this. Now, let's look at the situation now. Vaccination progress. Since the start of the national vaccination drive, we have now over 81 million total cumulative vaccination. To be exact, 81,761,062 doses already to date. And you can see the breakdown on screen there, over 81.7 million doses already. Yesterday alone, we administered over 792,000 doses. So there is progress in these numbers. This is as of yesterday at 1800 hours, and you should see that on screen, 9 November at 1800 hours. And we'll be updating this to you as the numbers go higher. We have, as I mentioned, we have no problem in terms of the inoculation drive, the administration, making the shots across the country. We have no issue about that, and the number will increase in the coming days and weeks shortly to reach our intended target for the month, for the end of November, for the month of November. Now moving on to the general situation. New confirmed case, we have 6,978 cases for today, as compared to the new recoveries, which is 7,679. So that is the new cases as compared to the new recoveries. We have active cases. Active cases at the moment, we have 96,463. 96,463, and there'll be an infographic there for you on screen. The green box on top is the number of cases being treated at the moment. And of course, on the left, new confirmed cases. Unfortunately, we recorded 62 new fatalities. The fatality rate is now at 1.00%. Just adding on a bit on the vaccination progress, we're providing more than 3.6 billion baht for research and development of the Chulakov-19. We mentioned this a couple of times in the past briefings. And also the Baya vaccine, locally made. This is Thai-made mRNA, developed by the Faculty of Medicine at Chulalongkorn University, which is currently performing phase 3 of clinical testing on volunteers and production for vaccine registration. Another 1.3 billion baht has been budgeted for the Baya vaccine, or Baya SARS-CoV-2 VAX-1 project. This is being developed by Thai researchers from Baya Phytopharm Company Limited in cooperation with the Faculty of Pharmaceutical Sciences at Chulalongkorn University. When Thailand can produce and modify both types of vaccines, Thailand will be able to cope even better with the outbreak of COVID and other infections in the future. There is an inquiry, as I mentioned, we often look on social media, in our inboxes on social media. There's many inquiries from foreign nationals or foreign friends or Thai nationals. One is goes like this. In order to enter Thailand without quarantine, you have to be listed in a country or territory, in the listed country or territory for 21 days. You have to be there for 21 days. Does this have to be just one listed country or 21 days for 21 days, or can you have visited more than one listed country or territory within those 21 days? For example, within the 21 days, you were in 21 days in the UK and Netherlands combined to make 21 days. So international travelers must have been in any one or more of the listed countries for a total of at least 21 consecutive days before traveling to Thailand. Of course, this is except for those with proof of permanent resident in Thailand. This would not apply to you. The 21-day would not apply to you. You don't have to be abroad for 21 days. So the answer to the question is yes. The answer is yes to that question if those two countries combine 21 days, if those countries are on the list, if those countries or territories are on the list. So today is quite a brief presentation for you. That's all I have for today. With that note, I thank you for your attention, and we'll see you again on Friday after the general CCSA meeting, wherein the Prime Minister of Thailand will be chairing to evaluate the 14-day mark after our opening up of the country. Thank you very much. Sawadee krap.